Erectile dysfunction is a very common condition in our society. 40% of 40-year-olds will have suffered some degree of erectile dysfunction at some stage, and 70% of 70-year-olds. Erectile dysfunction is the inability to have an erection sufficient for penetration. So it's a relatively common condition in our community. There's a lot of people that have erectile dysfunction that don't seek treatment. Unfortunately, there are a lot of good treatments available, and patients need to be educated that this is available to them. The other really important thing about erectile dysfunction is that really we should look at erectile dysfunction as a sentinel event for patients. It's a marker for possible other health conditions. Usually it can be a marker for vascular disease. Maybe that patient that has erectile dysfunction may have some heart disease and other issues, and so hence it's important for us to investigate these other possible coexisting problems, and we can really benefit a patient's overall health. So the usual test that we would do for erectile dysfunction is a hormone evaluation. We would do baseline blood tests, initially a full blood count, electrolytes, liver function tests. We check the thyroid, we check for diabetes by doing a blood sugar level, we check for the cholesterol and triglyceride levels, we'll check a blood pressure on a patient. We then do the hormone test, which is testosterone, FSH and LH, to make sure there's no problem with the hormone axis in that patient. We do an examination to check for pulses, make sure the patient's got good pulses present. We examine the testes. We check the prostate to make sure there's no evidence of any prostate cancer. Once we've done all those tests, we then look at managing the patient. Sometimes patients can have a psychological component for erectile dysfunction. So it's important to discuss the family dynamics, the family situation, the marital status, etc. And occasionally patients may just need counselling for improvement. The next step is to use oral agents. These are phosphodiesterase inhibitors. These have really revolutionised the management of erectile dysfunction. The three agents are Cialis, Levitra and Viagra. They're given usually on demand. So they're taken half an hour to an hour before sexual activity. And the important thing to remember is patients have to be in the mood for these to work. They won't just work miraculously. They actually have quite a low side effect profile rate, some dyspepsia, some discomfort in the epigastrium, occasionally some nausea or some headaches. Studies have shown that there's no increased risk of any heart problems with these medications. But if you're on any nitrates, special heart medications, it's important to tell your doctor because they interact with these. Cialis, one of the agents, can also be given on a lower dose on a daily basis, so that if patients don't wish to take it on a demand basis and they're embarrassed about taking it and don't like the idea of planning for sexual activity, they can take a lower dose, 5 milligrams, on a daily basis. And this can be efficacious, for example, for single people who don't have a partner. Sometimes taking these medications is all that's needed to improve erectile dysfunction, and patients can then stop taking them because their cause might be psychological. So that's usually my first step with erectile dysfunction. The second step is a vacuum pump device. This is a device that is inserted over the penis. The patient purchases this. There's a one-off cost. The patient pumps the vacuum pump. It creates a negative pressure. The penis becomes erect, and the patient slips a firm band over the base of the penis. This allows the patient to have sexual intercourse. The disadvantage is that there's a bit of a hinge effect because the erectile tissue goes inside the patient, and the vacuum pump only works on the outside part. It is, however, relatively easy to use, inexpensive once you've purchased it, and you can use it multiple times. The third option is penile injection therapy, which is prostaglandin or trimix injections. These are injections that are given into the penis. A patient draws a little amount of fluid up and injects it into the side of the penis. Initially, this can be quite daunting or concerning for patients, but once they try it, it's very simple. It's like patients giving themselves an insulin injection when they have the diagnosis of diabetes. It's very efficacious. It takes 5 or 10 minutes to have an effect, and it can last up to half an hour to an hour depending on the dosage that's used. So the success rate for this is very good. It's important, if it's not right initially, to see your doctor again to get the dose rechecked and ensure that you're using it properly. The main side effects are some scarring that occur from where the needle is put in, but if you rotate this site, that risk is very low. And the other side effect is priapism, which is a prolonged erection. That usually occurs if the dose has not been given appropriately, and it's quite rare if the dose is given at a low dose initially. But if patients get this, it's important to go to the accident emergency department and get treated straight away so that you don't have any permanent side effects. So prostaglandin injection therapy is an excellent treatment that's available for patients. So my first line is oral agents, followed by a vacuum pump or prostaglandin injection therapy. And patients usually will have some of these treatments. The other option, which is greatly underutilised in our community and is very efficacious, is a penile prosthesis.